All right, let's continue then on our conversation regarding vaccines and looking at sectors that are mostly affected by this pandemic. One of them being the restaurant industry. Restaurant Association of South Africa says the dialogue in dealing with this pandemic needs to change from pure reactive panicking to reactive planning and learning. For more on this, let's speak to Restaurant Association of South Africa CEO Wendy Alberts. A very good afternoon to you, Wendy. Thanks as always for joining us here on SABC News.
Thank you very much. How are you today?
I'm very well, thank you, Wendy. Let's discuss your views then on mandatory vaccines as a start. You've said that businesses can't survive if this is to be implemented. Elaborate on this for us, please.
So there's a couple of opinions that we are exploring at this point in time. The first opinion, obviously, is that we're trying to ascertain. So we've got a task team at this point in time engaging with various people within the healthcare sector to understand how many beds are actually available for COVID. So what we're going on is we have this narrative that we keep repeating, and we find ourselves as a restaurant sector that we're in the same position year on year.
Yeah.
So every time that there is a threat of a lockdown, it is all about the numbers. The minute the numbers sort of hit around about 10,000, we have the potential threat of a hard lockdown. So what we're saying is we actually need to ascertain how many beds are actually available. So whilst there might be 10,000 positive cases, we can't shut the economy down if the beds are not full. And we're trying to revert back to the original argument where at the onset of COVID, the reason for putting the country into lockdown was to prepare the healthcare system.
Yeah.
So it's 2 years into the state, and we say now, has the healthcare system been suitably fitted to accommodate the different waves? We also know that we should have been well prepared for this next wave to have minimal impact on the economy, and there should be no economical sabotage on our industry or any industry. Mm-hmm. So what we do know is that it's unannounced, it has happened, it's hit us, and the only solution is another threat of a lockdown, which really impacts our industry. So we've been having these conversations about numbers. We've been having these conversations about, how many people are testing, how many people are testing positive, and what is going to happen in an environment where we're trying to ascertain and understand. We're trying to understand and ascertain what are the hospital beds, what is the obligation on government's part to have provided and adequately prepared the healthcare system.
Yeah.
So we want a comparative to say from the first level of lockdown when we were going into preparation, how many beds were available, how many beds have increased, and what is the capacity of beds through the different levels of lockdown. So we certainly got a task team accumulating and getting that information. Yeah. And the conversation around that really is, how do we go into lockdown if there are still beds?
Yeah.
The next conversation we're going to have with government, obviously, is one where they have concerns about the impact that liquor has on the trauma units in and around South Africa. So we're also calling for that intellectual data that we can also put a position together to understand, is it because of trauma cases from restaurants, or is it trauma cases from illicit trade? So is it through the levels of lockdown that we currently face with, or is it after lockdown that we deal with the amount of trauma cases because they're in uncontrolled spaces? Then we talk about the vaccines and the position of vaccines at this point in time. And by law, a policy of mandatory vaccines cannot be implemented by government until Parliament has dealt with the matter. So what they're doing is that they're using private sectors to get into conflicting conversations about their positions on mandatory vaccinations. Mm-hmm. When we're in a country that only around about 30% to 40% of people have taken up the vaccination. So it means we're going to deplete the economy in any event because people haven't vaccinated by holding mandatory vaccination cards for entry into any public sector. So these are further conversations that we really need to have with government. And it's a subsectory conversation to lockdown. Imminently now, what we're trying to do is avoid any threat of lockdown on the restaurant sector. And that is why we cannot just contain ourselves in the numbers by accepting a blanket approach on lockdown. So we're writing a very strong letter to President Ramaphosa today. He should receive sight of this, really just unpacking all these positions. And we want government to take accountability that they haven't properly prepared, or if they have properly prepared the healthcare system, to give evidence that the healthcare system can adequately manage and maintain the different waves that come in. There's already a prediction of a fifth wave going to hit sometime in April, and a further wave and a further variant. So we need to live with this without sabotaging the economy, without depleting the restaurant sector. Any type of restriction for us is going to be a bloodbath. It will be fatal for our industry and for the amount of employment that stands to be lost.
I must say, I was a little bit surprised that the Restaurant Association stance is not pro-mandatory vaccines, because one would have thought that if, people are, I'll use the word forced for lack of a better word, if people are forced to vaccinate, that means that everybody can go into restaurants and things go back to normal, as it were. So I'm surprised that you're saying that you're not necessarily for mandatory vaccines, and one wonders, is that because that would mean turning back people, turning away people who are vaccine hesitant or even anti-vaxxers? And for you, that's bottom line, isn't it, for restaurants, that you can't afford to lose customers? Is that some of the thinking behind not being behind mandatory vaccines?
So first of all, our position is not as you've articulated it on the media. Our position is to have engagement with government to ascertain whether or not the amount of mandatory vaccines is going to give relief that we will not go into another lockdown. And these are conversations we simply have not been able to have. If we take the rage, for instance, every single protocol, every single directive, as well as mandatory vaccinations for entry into that event was done. And yet the rage was still closed down. And these are situations we cannot be forced with, where we have discrimination and we also have the threat of further lockdowns. We need to understand and adequately prepare the healthcare system in South Africa and ensure that there are necessary beds available for the various levels of waves.
Yeah, you've mentioned that this conversation needs to stop being reactive panicking, but reactive planning. How do we move from this panic if it seems that the panic is widespread? I mean, if it seems that the leaders as well are in panic mode, as much as the message is don't panic, but the reality is that it does seem that the leaders themselves are in panic mode. So how do we move from what you've called reactive panicking to reactive planning?
Engagement is critical. We need to sit around and have conversations with the right departments within government, the right ministerial divisions, to unpack how this impacts our industry. One is, how do we control it? How is it policed? How is it managed? What is the implications if people do not take up the vaccines and we're sitting with the 40% vaccinated South Africa and the economy then is depleted on that position? These are further conversations and exploratory conversations we need to have with critical people. We can't be having them within the private sector. We are using the pandemic to create policy, to write instruction, but there are very many implications after instruction that is going to have maybe a negative effect on the industry and the economy of our sector.
All right, Wendy, thanks very much for talking to us then this afternoon. Wendy Alberts is CEO of the Restaurant Association of South Africa, and of course giving us their opinion then on the issue of mandatory vaccines and how it would affect the restaurant industry.